This is the use of the Fauchulator stainless steel ISTM or TSTM tool for IT band release. The patient is restricted in internal rotation. He has a hard end feel. Next rotation is firm and a little hypermobile, so it's pretty common. I'm going to first use the sharper edge to work superficially. The least aggressive edge is the largest convexity. So I could use an assisting hand to stretch the tissues or to fold the tissues. The mobilizing hand is going to assess proximal to distal, or distal to proximal, or proximal to distal to find restrictions. And upon finding those, I'm going to progressively scrape at the tissues and use it at around 45-degree angle to get the best use of the edge. As long as the patient can tolerate that, I will, and most of the time actually will start out with the largest convexity as opposed to the largest concavity. I'm repeatedly scraping until I feel the restrictions smooth out. It is very common that you would cause superficial discoloration or petechiae initially, and the patient should always be made aware of that, because sometimes they can come back rather upset if there's discoloration. That usually goes away with the deeper work and the scraping nature of the treatment. That it's also common to cause ecchymosis or bruising, and again, the patient should always be made aware of that. I recommend using a very highly oily lubricant. Something like a Free-Up is not quite oily enough. You need something that doesn't absorb into the skin. So initially, after the first layer is smoothed out, and let's say that might take about 3 to 5 minutes, I can progress in depth by flipping it over and using the flatter edge. So I can push a little harder. I'm sure that doesn't necessarily feel that good. I can hear him wincing. And probably for the duration and purposes of this video, I'm not going to film the whole treatment, but this, considering he's abnormally tall, his IT band is obviously longer, and an entire IT band treatment from here to here, encompassing laterally, anterior junctional area and posterior junctional area between the hamstrings here and a quad here, may take up to 20 minutes. Now, this treatment is useful for runner's knee or IT band friction syndrome, for hip bursitis, greater trochanteric bursitis, helps improve hip flexion, internal rotation, knee extension and flexion for tissue folding and lengthening. In case there's some sort of peripheral neuropathic issue or peripheral nerve entrapment, lateral peripheral cutaneous nerve is often released with this treatment as well. And obviously would help improve hip extension. I often find that once the IT band is sufficiently released, any inhibition in the VMO will also improve. Therefore, I don't really instruct VMO strengthening, as you can't really isolate it functionally anyway. You okay? Feels great, huh? Let's remeasure. I'd say it's a little further. The end feels better. Okay, stop.
Okay.
Okay, as a progression, the smaller convexities are mainly used either for friction, if I found a particular area that I wanted to do transverse friction, or to actually separate the junctional areas of the muscle. So if there's certain areas, say, where I feel his posterior IT band here and here are more restricted to the adjacent muscle, I would use the smaller edge to try and separate that. I could be nice and use the slightly larger convexity to initiate the separation. And after a couple minutes of that, after I felt it smooth out, then I would switch to the smaller edge. And again, the assisting hand is pulling in the opposite direction to promote stretch. That can't feel good. Okay?